They might be the first people in Colorado to be offered a vaccine, but frontline COVID-19 workers will also have the final say in whether they get immunized. KRDO News Channel 13's Lauren Barnes joins us live to break down the policies for the staff at both hospital networks in Colorado Springs. Lauren.
The question becomes, how will our top healthcare providers feel about taking on the role of the patient as Colorado rolls out its first phase of the vaccine?
Protecting the people who care for COVID-19 patients, the state says, will help save lives until the vaccine becomes widely available.
So those are people who are providing direct contact with COVID-19 patients for 15 minutes or more over a 24-hour period.
But inevitably, some will forego a shot at immunization. Governor Jared Polis putting the onus on healthcare employers on whether to mandate the vaccine or not.
Hospitals and healthcare providers have their own rules and employment policies that dictate who needs to be vaccinated for what.
According to UC Health, the vaccine will be optional for employees. A spokesperson for UC Health says, quote, "We are expecting the initial shipments to be very limited, and UC Health is unsure what percentage of workers will choose to take the vaccine when it's offered." Meanwhile, a spokesperson for Centura Health, Colorado Springs' other main healthcare provider, says it recommends employees get vaccinated for COVID-19 once it's FDA approved. However, it is also not required for Centura employees. A Centura Health survey estimates more than 2/3 of employees, including 90% of physicians, will choose to receive the vaccine as it becomes available.
The priority is for people on the COVID wards.
According to the state's website, it would likely be legal for public or private sector employers to mandate employee vaccinations, as vaccine mandates have generally been accepted in the U.S., especially in public health emergencies.